Sciences, and Dr. Doug Oliver, McMaster University. Welcome, gentlemen. I'll ring the bell at 4 minutes. You still have a minute after I ring the bell the first time.
Thank you very much, Madam Chair, Mr. Mayor, councillors, ladies and gentlemen. Good morning. My name is Dr. Paul O'Byrne. I have the privilege of being the current Dean and Vice President of Health Sciences at McMaster University. I'm joined this morning by my colleague, Dr. Doug Oliver, who is Associate Professor in the Department of Family Medicine and Site Director for the McMaster Family Medicine Practice at the David Braley Health Science Centre, this gorgeous and street. As you know, the David Braley Health Science Centre exists because of the city's very generous contributions for its construction, and we remain extremely grateful for this commitment. But today we want to share some information with you about the usage of the building as you consider the proposal to add a Bay Street LRT stop. As those of you on this committee know, McMaster University has been involved in discussions surrounding the LRT since shortly after the project was initially announced in 2000. The City of Hamilton and Metrolinx have been working with the university on two primary fronts: the planned stop at our main campus, and secondly, and more recently, the creation of a main storage facility for LRT cars on a portion of McMaster Innovation Park lands. But today, I want to speak to the proposed stop at Bay and King West. As you consider this important matter, we thought it might be helpful if we shared some information with you on the usage of the David Braley Health Science Centre and why we think a stop will be immensely beneficial at this location. Despite being open for just under 2 years, the impact of the Health Science Centre on downtown Hamilton has been immensely important and very substantial. The Department of Family Medicine at the Michael G. DeGroote School of Medicine and several other departments of our faculty operate in large. The centre houses McMaster Family Practice, which is run by the Department of Family Medicine, and which has already 16,000 patients attending this centre, and last year had over 75,000 patient visits. Clinic, which had 800 babies born to patients attending the clinic over the past year. Of this patient population, around 3,200 have obvious disabilities. 6,000 of these patients are living in downtown core areas considered to be disadvantaged by the city, and over home to numerous staff, faculty and students from all our faculties involved in research and education. We are also very proud of the unique and collaborative ties with the city's public health service, which is headquartered in the building, and to share the facility with this service and their clinics to see a wide range of patients. Now, the collection together and to build it, bring it to fruition, was specifically to aid some of the city's most disadvantaged citizens. The downtown core was a logical site for patients and visitors that frequently access public transit systems. Accessibility to the David Braley Health Science Centre is of great importance because it is the primary health science centre in downtown Hamilton. Many of the seniors that access the Health Science Centre are on fixed incomes, and as I'm sure you know, parking in the downtown can be expensive. If an LRT stop was created at Bay and King, many of these centres and other disadvantaged patients would be able to take advantage of affordable and conveniently placed public transit to visit the David Braley Health Science Centre. Now, we do appreciate the Council's consideration of this potential stop and understand that there are a large number of complexities that you must consider when determining where stops will go to maximize efficiency, to maximize effectiveness of the line usage for both citizens as well as future economic growth. My main purpose today was to share some of the background on the usage currently of the David Braley Health Science Centre, because we think it might be helpful to you in your deliberations. We at McMaster University would wholeheartedly support a stop at much for this opportunity, and I'm very happy to answer any questions you might have.
Councillor Farr.
Thank you, Doctor. I really appreciate that, and certainly we're meeting the projections that were predicted when this council committed last term. Hold back on the Phase 2 development, which is even closer to, hopefully, this Bay King LRT stop that was born of a tremendous amount of engagement with people like yourself and so many others in the precinct and all around. And during a time of public engagement, Phase 2 public engagement, as it relates to LRT. And our environmental assessment, which the addendum, of course, is a big part of today's agenda. Through you to the good doctor, 16,000 patients, over 70,000 patient visits a year. I think the prediction was somewhere around 74. 3,200 with disabilities, 6,000 disadvantaged in the inner city, 8,600, was it? Did you say seniors through you, Chair? Was it?
More than 3,600 seniors.
Okay, more than 3,600 seniors, and good to point out on fixed incomes. We just, through our budget process, I'm sure we will ratify a spike, an increase in parking both on our open surface lots and with meters. And there's not too many meters around the Good Health Centre across the road anyway. Somewhere along the line a couple of weeks ago when we were preparing for this important day, I read a tweet, and I think it was from media, actually, that pointed out, and there are other institutional amenities around, you don't pay taxes, and it was alluded to, following the tweet, that for some reason puts you at a disadvantage in terms of your opinion on this issue. The Bay Street stop, but as the LRT project as a whole, I was interested today when I saw your delegation coming forward, your opinion on that, and particularly as it relates to the many people, and there's many, many more, but the 75,000 patient visits a year, and how that may how you may respond to that particular analogy that was bandied about in our community not too long ago. Through you, Chair, to the doctor. That's the only question, and I'll listen to the response.
Thank you very much, Councillor Farr, for the question. And as I'm sure you focus in being here this morning and in thinking about this important issue is how we can advance. We're passionate about this. This building, as I alluded to in my presentation, is functioning at the highest level already, albeit only 2 years old. Dr. Oliver, who joined me here, who runs the Facility for Family Medicine, he and I spoke briefly this morning before coming before you, and there is an intention and an expectation that the number of patients will increase substantially over the next year or two. And in fact, it's become the place of first thought when CCAC and other people involved with the in our city are looking for primary care practice. This is where they come. So the number of patients who are disadvantaged in many ways, by handicaps, by poverty, by all of the things that we all should be worrying about in our city, this will be the place they'll be coming from. We do not, you're absolutely correct, as I understand it, pay taxes on this building. I don't feel particularly guilty about that. I pay taxes in many other ways, and so I'm very happy to have a health science facility that does function as well as it does. And I do feel that because of the care and thought we...
Councillor Whitehead.
Yeah, thank you for coming forward. what I've been doing with the unions and that, with a lot of the major employers in the downtown, where they're coming from, and we did have a report that indicate that the majority of them come from outside the downtown core. So when you break down your patients, and I know that there's a predominant amount of seniors, for example, in distress that live across the city and not one necessary geographic area. Have you done a geo code on your patients to determine?
We do have some information on that, as I implied during my comments, that we think that around 6,000 of the current patient population are coming from downtown core areas that you and we all would agree are disadvantaged. And from my discussions this morning with Dr. Oliver, that's going to increase markedly over the next year, because these are the patients that are being targeted to refer into the David Braley Health Science Centre, particularly for primary care. Many of these patients don't have easy access to a family physician, as I'm sure you know, and referral, this is becoming the source of the initial referral for primary care practice. So it's 6,000 currently, as best we can judge, but that's going to increase definitely over the next year or two.
Geocode, what have you drawn a sphere around the clinic and determine 1 kilometer, 2 kilometer, 3 kilometer, 4 kilometer, 5 kilometer, what the distances are in regards to the patients that attend this clinic?
No, I don't have that information with me this morning. It could be very easily obtained and certainly brought before you and presented to you if you think that would be of value in your deliberations.
Well, I appreciate it, because I mean,
comment that we do have heavy representation from every ward in the city coming to that centre for medical care of all types. Prenatal care, so pregnant women, frail older adults, individuals with disabilities of all types. Of where those postal codes are specifically residing, but it's easily over 60% are coming from outside of the city core right now. And as Dr. O'Byrne alluded to earlier, our goal in the next 3 to 5 years is to increase our patient and we want the doors to be opened for those 3,000 or 4,000 people that are most vulnerable in our community, and we want them to have access to that space. Thank you.
Yes, thank you, Madam Chair, and thank you, doctors, for your presentation. And so my question is, you've just discussed that approximately 6,000 people are coming into your centre, and would you say, by and large, that the majority of them are disadvantaged in terms of the economy, economically?
Yes, we think that of the 6,000 patients that are coming from the area that would be in Hamilton, the great majority of those would be indeed economically disadvantaged. But of course, from the other wards around that, as Dr. Oliver has said, attracts patients, very many of these patients are in disadvantaged in other ways, either because of disabilities, because of this is not a disadvantage, but the 800 pregnant women that are coming to the maternity clinic in walking distances with being 7-8 months pregnant is not it is a challenge. So a large number of the 16,000 currently would be considered to have some challenges that would make access to the clinic problematic if the LRT stop were not put where we would like it to be.
Well, if I harken back to my days when I was pregnant, I will tell you that it is a disadvantage to have to walk a long distance. So, but on a more serious note, so you have been doing some tracking, but so I'm curious, how are they? Have you been tracking how your patients get to the building? What type of transportation do they take?
Yeah, not particularly well in terms of specific. Folks do rely on bus transportation. They rely on people driving them in, dropping them off. Some folks have their own cars. But yeah, I can't give you specific statistics.
Yes, but it's more anecdotally.
Correct.
You're right, okay. Yeah. And my last point that I want to make is, do you feel that it is critical that if the LRT were to be built, that it needs to be affordable for these folks to be able to access it? And what if it isn't?
I think critically important. So if you have a wonderfully effective LRT line, As we do have some parking in the downtown area that's accessible but not affordable, that's not of great value.
Okay, and thank you for your answers. I appreciate it.
Thank you. I have no more speakers. Thank you very much.
Pleasure. Thank you.
And I understand that Cheryl St. James is back in the, Cheryl St. James